The suprascapular nerve is a peripheral nerve that can be blocked under ultrasound guidance. It's not clear exactly how the suprascapular nerve block works as well as it does, but for example, a 2022 study in the Journal of Clinical Shoulder and Elbow found that a suprascapular nerve block along with physiotherapy worked better than an intra-articular shoulder injection along with physiotherapy, and better than physiotherapy alone in treating frozen shoulders. And whereas there are some relative downsides to intra-articular shoulder injections with steroids, blocking the suprascapular nerve really doesn't have those downsides. Another treatment approach is to inject around the tendon or in the shoulder joint or around the suprascapular nerve for that matter, using a liquid non-steroidal anti-inflammatory medication called Toradol. Now, Toradol, it's also called Ketorolac, is like a liquid Advil or a liquid Aleve. The advantage of using Toradol as opposed to steroid is that steroid has some potential downsides in the shoulder and around tendons that Toradol doesn't have. Two alternative forms of treatment include hydrodilation and manipulation under anesthesia. In hydrodilation, sterile water is injected into the shoulder joint in order to stretch the joint capsular fibers from the inside out. It's a nice idea, and some patients report at least temporary decreased pain and improved mobility. But at the same time, there was a 2023 meta-analysis in the British Medical Bulletin that found that hydrodilation's clinical utility remains unclear. There are potential drawbacks, complications, and in the end, the meta-analysis concluded, and I would agree, that further research is needed on this approach. Manipulation under anesthesia is exactly what it sounds like. The patient's put under anesthesia, and then a physician manipulates the shoulder joint while the patient is asleep. There are a plethora of potential complications from this, including humeral fractures, rotator cuff tears, brachial plexus traction injuries. A 2019 meta-analysis concluded that there's not much quality evidence for or against the use of manipulation under anesthesia when it comes to frozen shoulder. Now, given this, and given that manipulation under anesthesia does carry significant inherent risks, it remains a very controversial procedure, one that should be viewed skeptically and undertaken only with the greatest of caution. My own view is that I wouldn't recommend it, and in fact, I've never recommended manipulation under anesthesia for a patient with frozen shoulder, or for anything for that matter.